Hello and welcome to my presentation on my health education and promotion philosophy. My name is Taylor Wareheim and I am a graduate student in the Health Education Behavior program at the University of Florida. Within this presentation, I am going to discuss my philosophy on health education and promotion and mention key points that support my philosophy statement. In this course of philosophy principles of health education and promotion, I was able to learn the importance of implementing the concepts of autonomy, cultural competence, and empowerment while caring for my patients as a health education specialist. In my future occupation as a nurse, being culturally competent will allow me to better be able to deliver patient-centered care to patients whose beliefs and values differ from my own. It also gives me the chance to learn about and develop new perspective on my patients' cultures. Giving my patients autonomy ensures that the patients I care for will be actively involved in their diagnosis and treatment and ultimately lets the patient make their own informed health decisions, which creates a respectful relationship between my patients and I. As I am a nurse in the future, by educating my patients through providing access to health information and health resources, I'll be able to empower my patients to be proactive and motivated to take action in their health decisions. After sharing my presentation, you will have a clear understanding of what my philosophy entails and how the supporting evidence I provide explains the importance and intent of my professional philosophy. As a health education specialist, the focus of the care I provide will be directed towards the individual's needs, desires, and interests in regards to their health. I will ensure the individuals I care for have control of making their own informed health choices by providing autonomy. I will strive to create an inclusive environment in which I appreciate and respect the uniqueness of others by showing cultural competence in my care. I aspire to empower the individuals I work with. My goal is to educate and promote healthy lifestyle skills and strategies to best suit the needs and interests of an individual, in order for the individual to be fully equipped to make healthier life choices for themselves. In the following slides, I am going to present evidence that supports my philosophy statement. My first argument is that I believe that as a health educator, supporting patient autonomy is critical to improving patient health. According to a study which examined how patient autonomy is one of the key factors to better patient outcomes, there are several aspects of patient autonomy that positively influence patient health. The first point is that when a healthcare provider supports patient autonomy, it ensures the patient will be actively engaged in making their own health decisions and allows the patient to make health decisions that are based on the patient's best interest. Patient autonomy also helps to create the development of a trusting and open relationship between the patient and provider. For example, when providers give their patient a sense of autonomy, it demonstrates that the provider is making an effort to understand the patient's experiences and speak openly and honestly with the patient in terms of strategies and options of treatment, which increases a patient's overall trust in their provider. Lastly, providers who support patient autonomy in their care can boost a patient's confidence, as giving the patient control of their health decisions makes the patient feel confident about the health decisions they choose to make for themselves. In the past history of healthcare, providers largely made decisions in medicine based on what they thought was most beneficial for the patient. However, in this day and age, medical paternalism has given way to a growing appreciation of patient autonomy, or the patient's right to make decisions. Although the patient ultimately has control of what decisions he or she makes for their health, the provider's duty to the patient still exists. The provider must help the patient through this decision-making process, even though they are not making the decisions for the patient. The provider can help by sharing the depth of knowledge and resources that the patient does not have to best equip the patient to making the best, most suitable decision. Health education specialists deal with the principle of autonomy frequently, especially when it comes to encouraging others to adopt healthier lifestyle behaviors. Health educators must respect others' freedoms of thought, action, and choice. As the provider is in the back seat of the car helping the patient facilitate the various options of health decisions, and the patient is in the driver's seat having full control of the decisions being made, there can be times where the provider does not agree with the patient's decision or does not understand the patient's rationale behind the decision they chose to make. Sometimes certain health decisions are made by patients based off their cultural beliefs and values. Therefore, providers can be confused or frustrated with health decisions based off cultural beliefs or values if providers are not knowledgeable about other cultures other than their own. This is why it is essential for the provider to acquire the skill of cultural competency in order to understand different cultures through exploring the culture's value, beliefs, and perspectives, and how those factors can influence a patient's decision making and their health. Now, I want to ask you how health education specialists can become more culturally competent. According to the Principles of Health Education Promotion textbook used within this course, the term cultural competence is defined as a set of values, principles, behaviors, attitudes, and policies that enable health professionals to work effectively across racial, ethnic, and linguistically diverse populations. Therefore, culturally competent care means providers tailor the care in a way that respects and meets the patient's diverse cultural values, beliefs, and perspectives. There are three crucial aspects for a health education specialist to become more culturally competent. The first aspect of developing cultural competence is to have the knowledge. This means being aware of different cultures by educating yourself on the shared traditions and values of specific ethnic groups. Providers should spend time in learning about the cultures of the populations they treat, as well as learning about distinct cultural perspectives, such as how the culture tends to view receiving treatment and the culture's view on recovery and health. The second aspect of developing cultural competence is to have cultural awareness. Having cultural awareness means the provider will be familiar and acknowledge the attitudes, practices, and behaviors of a specific culture. Cultural awareness allows for more effective communication between the patient and provider regarding the culture's communication patterns and customs regarding health. For example, having cultural awareness is important in pregnancy care because many cultures believe in proper care of the placenta, and there are many rituals with how the placenta is cared for once the baby is born. Having cultural awareness regarding placenta rituals can lead to effective communication between the provider and the patient to determine how the patient wants the placenta to be handled by the provider during the birthing process. The third aspect of developing cultural competence is developing a skill set that ensures the delivery of culturally appropriate care to your patient. For instance, an example of a skill the provider could develop is communication skills. The provider can learn how to adjust communication styles to a client's culture. For example, a provider could change certain medical phrases or words to fit the patient's cultural values when explaining care and treatment options. Another part of my philosophy is that I strive to create an inclusive environment in which I appreciate and respect the uniqueness of others by showing cultural competence in my care. Efforts to improve cultural competence among health education specialists would help in improving the quality of care for patients. According to Georgetown University's School of Public Policy, patients are more likely to suffer from adverse health effects, receive poor care, or be unsatisfied with their treatment if physicians, organizations, and systems are not cooperating to offer culturally competent care. African Americans and other ethnic minorities, such as Latinos and Asian Americans, report poorer levels of satisfaction with care, worse levels of quality of care, less involvement in medical decisions, and less partnerships with doctors when compared to whites. The image being displayed on this slide shows that in comparison to white individuals, African Americans, Latinos, and Asian Americans are more likely to say that they would have received better care if they had been a different race or ethnicity. This upsetting evidence shows the importance of health education specialists incorporating cultural competence into their care. Giving every patient the best care possible, regardless of their race, ethnicity, or cultural background, is the purpose of providing culturally competent care. Some of the common cultural competent care strategies which can be utilized to improve the quality of care a patient receives can include providing interpreter services to help eliminate the language barrier between provider and patient, allowing providers to receive help from traditional healers to help develop treatment options and plans for the patient, and educational lessons will be provided to patients with low literacy skills, such as showing patients how to read and interpret medication instructions and help the patient learn how to fill out medical forms. Efforts to improve cultural competence among health education specialists would assist in eliminating health disparities. Georgetown University's School of Public Policy discusses several ways culturally competent care can eliminate health disparities, such as providing impartial quality care and establishing clinics in geographic locations in order to provide easier access for minority populations who are more negatively impacted by health disparities. The Principles of Health Education Promotion textbook used within the course defines empowerment as a social action process for people to gain mastery over their lives and the lives of their communities. As a health education specialist, empowerment can help my patients obtain more autonomy over choices and behaviors that affect their health. A study conducted to investigate the effects of patient empowerment discovered that patient empowerment creates a boost in patient satisfaction with the care being given by the provider. It enhanced patient compliance with treatment. It allows patients to feel more in control of their health, and it improves the clinical outcomes of chronic diseases. I gained knowledge about the significance of applying the ideas of autonomy, cultural competency, and empowerment while providing patient care as a health education expert through this course on philosophy and principles of health education and promotion. Being culturally competent will improve my ability to provide patient-centered care to patients whose views and values are different from mine. Additionally, it gives me the ability to get new insights into the culture of my patients. By allowing my patients to make their own informed health decisions, I can develop a respectful connection with them while also ensuring that they are actively participating in their diagnosis and treatment plans. I will be able to enable my patients to be proactive and motivated to take action in their health decisions by teaching them and giving them access to health information and tools. This presentation was presented to give you a good idea of what my philosophy involves and how the evidence it provided explains the significance and goal of my professional philosophy. I hope you enjoyed hearing my presentation. Thank you and have a good day.